Good afternoon. This is Dr. Bill White with the American Orthodontic Society, and I want to talk to you this afternoon about a thing in orthodontics that we haven't mentioned before, and that's where you have to work with the buds of teeth that are forming, and sometimes they're real late in developing, and you can actually go down and roll those buds over, or it's possible to take the bud and put it in another hole. It will take about half the time it'll start growing in the other place like that. So this is some of that, and I'm going to show you. It takes some time to get to the tooth. The bud is down below a deciduous molar, so we have to take the molar out early, and then we have to hold the space up, and I do that with a step down arch. We hold it, and then we went down around the bud and rolled it and headed it in the correct direction, and we have to hold it there, and it's going to take longer than normal for that to come on up through the tissue. Sometimes I take the tissue off the bud and let it come up quicker. And then also this young lady is missing her upper wisdom teeth, or something is missing up there, but she has teeth that are there, and it's usually a half-breed, kind of between a 12-year molar and a wisdom tooth, and they don't come in until she gets a little older, and they come down. So these are things that happen to you, and I just wanted to show you this and talk to you just like you were sitting right here in front of me, and I hope that you pick up what to do with that. But you can do a lot with buds, just rolling them around. You could also move them with the follicle of teeth too. So let's get going on this, and I'll show you this. Start with, this is a nice young lady. She's got a little bit excess vertical dimension, but not much. But a very nice young lady, and she was nice to work with, and everything went good, but I was never able to get the absolute final pictures of her case. You just can't get everything you want when you're doing this, and it took several years. I think we started this in 1993, and I don't think we finished it till 97. We had it, that was my last part, so I didn't finish it till after that. So, and it's not your fault because it takes a long time. It just takes that time for those to develop, and you have to hold the braces on there to keep everything else in line. So let's go, and I'll show you what we did here. Now, she had several other orthodontic problems. It's rare that you have any special thing that's happening. And I'm just going to mention them as we go along. Like, we didn't need to take the frenum out here. If you straighten the teeth up, they come together pretty good, but some people go in and take the frenum out, and I've done cases where you bring the teeth together. Now, if you get somebody, their parents have got a big diastema, you might as well figure on pulling that together and removing some of it. But anyway, here we're not. Now, right down here, we're missing a tooth, and this tooth is in a bud down deep in the lower left side of her mouth. And let's take another look at another picture here. On this side, we've got a little gap in between the teeth right here. And this, I'm sure that she's got a slight lateral tongue thrust where the tongue is pushing out on the side. And we got one side closed good, but the other side, the last pictures I've got, she's still got a little opening in there. And I've had people with persistent tongue thrusts where the lateral side of the tongue, either they bit on the tongue or something held the teeth apart. And I never was able to find one of them. I sent them back to the school and everything, and they never did find that what we were planning to do was to remove part of the tongue, but they didn't want to do that. Okay, let's get on with the rest of this. Now, this is the side where we've got the bud that's just developing down here, and it had a baby tooth in there. It'll show in the x-ray in a little bit. And we also have a bad shape for the upper arch. It's kind of curved in, kind of narrow. We need to widen this out and bring it out, which we did. You will be able to see that later on when we get in there. So I'm going to try to do this if I were just talking to you here and you were right out there in front. If we had this figured out where you could ask questions or something, maybe we'll be able to do that someday, and we can answer them right while we're talking here to people. All right, the lower arch now had this baby tooth in this area, and I had to hold the space open for a couple of years here to get this tooth to come up in this spot. So we put a little band here with a space maintainer in here before we actually started the orthodontics. And once we started the orthodontics, lining everything up, we dropped the wired out over here and picked it up, and this had a kind of a step down arch that held the space open for this tooth to erupt while we're waiting on the 12-year molars to come in on the bottom. Here now, this is 1993, 5/3 of that, and she's aged 10 years at this point. Now here is the tooth. The tooth is headed in this direction, and if you just leave it alone, this would never go. It's not going to eat the tooth away. Over here, this one is late coming in too, and so we were able to get rid of this, and this one came on in normal. Now, there are no wisdom teeth on the bottom at this point, but I think we formed wisdom teeth down here, but nothing up here. And this tooth is a 12-year molar, and this young lady is 10 years old at this point, probably a little over 10 years old. And so we're late getting the cuspids are coming in. They're all right. That's not a problem. Now, here you're going to have to take this tooth out, and you're going to have to go down in here with a spoon and roll this tooth around and point it up. And you have to kind of clean off the follicle around it to get it to go. So this is going to make the tooth erupt even slower. So you have to take away some of the tissue to get this tooth to come on up into place without waiting a lot longer. So here we started this back in 93. That's when I looked at her. Let's go to the next x-ray. This is just a close-up of that, and you can see we need to turn this tooth around. This is the top of the tooth, and head it here and then rotate it one way or the other so that it erupts free in here. This baby tooth is no resorption at all, and if you just left it alone, it wouldn't be. There'd be a space, a big space in there, and this is also interfering with this bicuspid coming in here. So we take this out, then we put a space maintainer in this part to hold this open before we started the orthodontics. And then later on we started up with the orthodontics. So here we are, and we're going to band this tooth and run over and come like that, hold this space. And now we've turned the tooth around. We pulled this out and took the baby tooth out of there. We also checked this one over here, and this is ready to go. And the upper one is going to go too. And these are coming in pretty normal. This is a bicuspid permanent one, and the cuspid, and this one will come on in without any problem, and I think this one did too. Now the 12-year molar is I personally just call them a kind of a half-breed. It's not a wisdom tooth, it's not a 12-year molar, because she's at age 10 now and this hasn't come down very much, and that's age 10 and 3 months. Okay, this is that space maintainer, and to speed this up a little, I took some of this tissue away from this to free it up where it would drift forward as the root starts to grow. Now you watch this, it's going to grow a root down here. And normally as the root grows, the crown goes up, and the tip of the root will be down in this area here if it comes in right, and I think this one did that. And now here it is again. We've got it turned around, and this is he's 11, she's 11 and 3 months old. This is 94, and this root has not started growing. This one is already in. Everything else is coming along. The 12-year molars up here, or the half-breed molar, is not doing much. There's hardly any roots on them either. And so we've got, this is something that will just come up on you. And you think, well, I'm not going to do any real tough orthodontics, and it'll come and be problems you will not even dream about on cases. So prepare yourself for everything that might come along. You never know exactly what will happen here. Now, we're forming wisdom teeth back here. I can't see the one on the other side. Let's look at here. All right, this is a close-up, and that tooth looks good. If it wasn't correct, I could go back in through this tissue, and you see the little lines I got on there. I took some tissue off, and I could turn that tooth or rotate a little bit and help it come in. I could have taken that tooth, and if you had pulled the tooth over here, you could put that bud into that hole right there, and most of the time they'll grow. I've had teeth that were partially formed, and accidentally, this was back before I did nothing but orthodontics, and I was trying to take a tooth over here out, and I loosened this one, it raised up, and I thought, oh Lord, that tooth I've ruined it. But I pushed it back in and kind of sewed it up, and the tooth took and grew just like normal. I watched it for several years, and it came in normal. So you can do things with developing teeth. All right. Now our 12-year molars down here are coming in. This wisdom tooth that's growing is kind of blocking it off over here, and I don't have room enough to see this, but I think there may be something growing there. Now this is this half-breed teeth here. They're coming in, and here it is. She's 11 and 8 months, and those are late 12-year molars coming into the mouth there. Our bud is sitting here. Now if you look real careful, I started the orthodontics, we just put a step down arch in here, and that holds that gap for this tooth to come in. Give it plenty of room, then you can close up once it gets up in here. And this will happen to you sometimes, and so you know what to do. If you don't, go back and look at this video, and I hope I'm telling you the right thing here. All right, here this is age 12, 1 month, and these have begun to grow roots, and they're coming down, and I can't hardly see that, but this tooth is coming on up in that space. And the 12-year molars are here, and we've got wisdom teeth and on the bottom on that side. Okay, now this is Spanrex number 7, and this is 1022 of 90. I can't see, but it's getting way on up in the 90s somewhere. But our tooth has popped up in here, and we've bracketed it, and we put the tooth in place there. That looks like about a 97 or 8 or something like that. So we worked on this young lady for several years, and it wasn't that we were slow. You just can't make them grow that fast sometimes. And the 12-year molar still hadn't come in here, and she's 12 years old or 13 years old in 6 months, I believe there. All right, here is the last Panorex I think I've got, and it is 97, I'm sorry. And she's 14 years old, and the 12-year molars have come in place, and this is lined up good, and we've done the rest of the orthodontics, but we've got a little space in here. I think the young lady has a lateral tongue thrust, and I was not able at the time she came in for that to get a picture of that point, but this is 6 of 97. So let's see what we got. So here we are looking at the finish, just about the finished case, except we've got this lateral tongue thrust. Now these teeth are meeting together good. I had one other young lady like this. We could pull those teeth together and turn it loose, and it would open right back up again. The lateral tongue thrust where they had an oversized tongue in there. And this is looking pretty good there. That's 96. 96 again. It's fitting down pretty good on the right side of the mouth. The left side, it's got this opening in here. And this is the tooth that we have brought in, and we'll look down at it from the top. And if this comes up to you and you have to do that, this is the tooth. You see it's got a little different shade to it. And it came in, but we were able to tilt it and bring it down and work with that tooth way before it developed into the mouth. And I think if you had a hole over here, you could have taken that bud and put it in there. And I've had that happen. We've got a case where the oral surgeon put the bud in he actually formed a hole and put it in there, and it took and grew. So that can happen. And here we've got the 12-year molars, the second molar banded here, and everything's lined up pretty good. That gap is still there. We couldn't get that to close down. We could close it down, but it'll open back up again if he's got this lateral tongue thrust. So we've got a rectangular wire in here, and we've got all the torque and everything in the teeth that we need. Now this is the last picture that I got of this young lady, and here this tooth is, and this is 10 of 96, and we started it in 93. And so it didn't take us that long to do the case, but you can't speed up a bud like that growing. Thank you for watching, and I hope you get something out of this. And if I want you to join our group and subscribe to it, and write us a note, or if you have a question, we'll try to get around to answering the questions if I can. And sometimes they're so complicated I can't really, without seeing the patient and really working it up, get the exact right thing. But we'll give you some idea about it. And so thanks for watching again, and I'm going to sign off and stop. So I hope you know what to do in this situation.